Hi guys, Heidi Cooper here, functional medicine practitioner, licensed esthetician from Skin Side Out. Today I want to share some risk factors for parasite infection. So earlier we did a video that I shared 9 different symptoms of parasite infections, and so today I want to share some different risk factors and some things to look for. So risk factors include eating pork, shellfish, or sushi consumption. Those can be risk factors. And then even raw fruits and vegetables, sometimes if they're not properly washed, they can carry parasites as well. So once again, I covered earlier in the other video that here in the United States, a lot of people feel like they wouldn't have parasitic infections, or they've kind of been led to believe that that's not a possibility. However, it is much more common than you would even believe, and it can cause a lot of destruction to people's health, and there's a lot of really great ways to address this. But just want to share some of these risk factors that can make you a little bit more vulnerable to some of these infections taking over. So antibiotic use is another one. If you've had antibiotic use on a real regular basis or chronic antibiotic use, that can really create a vulnerability for parasitic infections to take hold there. And international travel, of course, if you've had exposure to different countries, just because you have gone there maybe even years ago, and you may have just not really connected the dots that some sort of infection may have taken hold while you were traveling at some point, it's definitely a possibility. In fact, some of these parasites can live in the body up to 30 and 40 years. So just keep that in mind if you've done some sort of international travel at some point. And then poor dietary habits and chronic stress and poor sleep habits really certainly contribute to a vulnerability for parasitic infection as well. So then some of the things to look for are, we can do lab work that's specific to the parasitic infections, but some of the things that we can see sometimes that clue us in that maybe there is some sort of parasitic infection there are even looking at like your WBC, your white blood cell count, and if that's either high or low, that can be reflective of a parasitic infection. And then low or high iron can also be a sign. And then high C-reactive protein, so those inflammatory markers, can be also a reflection of parasitic infection, as well with high eosinophils and high liver enzymes. So those are things that you have when you have regular lab work done. Those are typically values that are run. Now we look at them more in functional medicine ranges, so those might be a little bit different than your doctor's office typically would look at them. But when you see some of those markers that are not in optimal ranges, those also can be reflective of potentially a parasitic infection there. And then there's some deeper testing that we can do if we want to find out specifically what type. Although they can be really difficult to test for sometimes because they like to hide. So hope that was some helpful information for you. If it was, please like and share this video. Parasitic infections are much, much more common than you would ever even think that they would be, especially here in the United States. So don't want anybody suffering unnecessarily, and there's certainly ways for us to treat them effectively. So health and happiness. Have a super fantastic day. Thanks so much.